Good evening to those of you that are joining the stream. Good evening, welcome. We are back with our live stream. We have a special guest this evening, our guest expert, Leandrea Long. So please do tell a friend to tell a friend. Go ahead and hit that share button, like, comment, jump in there. You don't want to miss this. So this is a special live stream this evening. And of course, that is because Leandrea Long is not only a fellow certified lymphedema therapist like myself, but also a daughter of the soil, as I keep jokingly telling her. But I want you all to invite, share. Good evening, Bashta Richardson. Nice to have you. You look like a new face onto our stream this evening, and I'm happy to see you. Thanks for joining us. Thanks for joining. I'm just going to give it another minute or two for persons to join into the stream. Okay. I'm going to go ahead and get the stream shared also. So let's go ahead and share. Also, this is a good time to let me know how my audio sounds. Let me know if you can hear me nice and clear out there. So I'm going to go ahead and give a share on the stream here. I'm sharing to my personal page also. Okay, so I see that notifications are taking a little moment to go out. I don't think I have even gotten a notification as yet about my own stream. Listen, Facebook is serious these days, y'all. Okay. But nonetheless, we are going to forge ahead. All right. So I'm getting this shared to my page so no one can say that they didn't know and they missed it. So that's their invitation and their chance to come and hang with us tonight, because this is going to be a good one. I'm excited about this one. I mean, I usually have pretty cool guests, but I mean, this is just like extra special. Oh, thank you so much for your kind comments, Rain. Thank you so much. It's nice to be seen here. You all know that we are changing up our format for the show. And so we're doing interview style. So when I find these amazing, usually women, we have a community of mostly women, and there's a special place in my heart for women in business, women entrepreneurs. And listen, I just love it. I love to see it. I love to be a part of it. I love to support it. I love it from all angles. So I'm always here for it. When I find these extra special women that have so much to offer the world, so much to contribute, I have to bring them to you all and expose you to them so that they can, enrich your lives, because that is really a big part of what our community is about. All right, so this is our share, invite, comment time. Don't forget to share to your pages, tag persons in the comments that you think may be interested. I'm going to go ahead and put our topic of the evening up, and that is the role of lymphedema therapists in post-op care. All right. So we're going to get ready to get started here. Going to get ready to begin. It's going to be an exciting one. Make sure that you share. You always want to be someone that shares. Thanks to any of our first-time guests stopping through. We love to have you. We hope that this won't be your last time here with us. Just going to get Instagram rolling over here as well. All right, let's get our Instagram fam on the line. All right, so we will give that just a brief moment to go ahead and notify our persons over there on the gram. So hopefully a notification should be going out shortly so that we can have, wow, we're on all of our platforms this evening. Well, y'all know this isn't even all of our platforms. We're on all of our platforms that we stream to. We are here, we are on Instagram, we are on Facebook, we are on YouTube, we are on LinkedIn this evening, y'all. So we're spreading it. We're spreading it all across social media. All right. So definitely, definitely, if you do not follow us on all of those channels, be sure that you do so because we are going to be changing up our content. We're going to be putting different content on different social outlets. Feel free to follow us on all of those outlets, or you could just follow us on whichever one is your favorite, where you spend the most time. All right. All right, all right. So let's get ready to jump in here. So, welcome, welcome, welcome to the stream, everyone. Thank you so much for coming. For those of you that may not be familiar with me, I am Dr. Felicia, physiotherapist and cancer wellness coach, certified lymphedema therapist. So I have worked in the health and wellness industry for over 10 years, and I help cancer survivors navigate the challenges that can occur after dealing with cancer treatment. So for persons that want to get their life back, that want to also then change their lifestyle so that they are living a healthier life and hopefully reduce the reoccurrence of cancer. Okay, so that's a little bit about what I'm about. If you hadn't heard, if this is your first time here, if you didn't know, now you know. Okay, so our topic this evening is going to be the role of the lymphedema therapist in post-op care. All right, so I'm going to go ahead and bring my guest on stage from backstage. So welcome to Leandrea Long. All right, so I'm going to go ahead. Welcome our guest, everyone. Thank you all so much for being here to be with our guest expert this evening. Okay, so I'm going to also thank you all so much for being here to put Mrs. Long on over here on Instagram. Okay, so you should be popping up shortly. I just accepted your request to join. So look out for that. Here you come.
There we go.
Hello, hello, hello.
Hi, how are you?
I'm well, and you?
I'm excellent.
Awesome, awesome, awesome. Got to love it. So glad to have you. Thank you so much for agreeing to be our guest expert this evening. And let me tell the people just a little bit about you because I could run this whole resume to let them know how accomplished you are. But I'm just going to give them a little taste and I'm just going to let y'all know she's accomplished, y'all. Okay. Like, don't sleep on my girl. Like, she is out here doing it, doing it. So, a little bit about Leandrea Long, our guest expert of the evening. Leandrea Long is an advanced practice registered nurse, a certified lymphedema therapist, and a certified clinical nurse leader. She has been in the healthcare field for 20 plus years in different capacities. She became a certified lymphedema therapist in 2021, trained by the Norton School of Lymphatic Therapy. She currently specializes in the management of patients through telehealth with peripheral vascular disease, varicose veins, lymphedema, of course, and provides aesthetics services such as post-op care and body contouring using non-invasive modalities. Leandra recently retired, y'all. I'm sorry. I was trying not to stop like in the middle because I already had some like side comments, but retired. I couldn't even roll past that one. I wanted to, but let me keep rolling. Let me try to stay on track.
Please.
Recently retired from the acute care setting after 16 years to pursue entrepreneurship, starting her own business, Lymphatic Aesthetics Wellness Center, LLC, whoop, whoop, a mobile concierge medical and aesthetics company that brings health and wellness to you. in the comfort of your home, Airbnb, or hotel. Okay. So Leandra is passionate about providing quality, safe care to her patients and providing them with the necessary tools to help manage their chronic diseases, as well as enhancing their natural beauty through non invasive procedures. Here is a little bit about Leandra the woman. Leandra is a native of the Bahamas, the youngest of three raised by a single mother. She has two daughters of her own, Riley and Marley Long. Okay, and she is a wife, married 12 years to her husband, Jason. She loves to read self help books and the Bible, loves to travel, try new foods, and spend time with her family. She wholeheartedly believes in God and in getting an education. We have so much in common. we have so much in common. Like it's refreshing to see. I'm not retired though. I don't know if I have anything that I could retire from. I want to put, when am I going to put retired on my resume, like Leandra? But we gonna circle back. But
Oh
yes,
God.
so that's a little, but tell us a little bit more. Tell us a little bit more about you, even outside of your work.
Oh wow, Dr. Felicia. Well, you said a mouthful already. I'm a whole host of things. I am, like you said, I'm a wife, I'm a mom, I'm a foodie, I love food, I'm a world traveler. I love to work out. I'm a fitness, fanatic. I am an entrepreneur, clearly. I own not one, but two businesses, one of which is co owned by my husband. It's called Fed Up Barbecue. And I'm going to be a little bit biased, but I think we make the most mouth-watering barbecue in Orlando. So if you're ever in the Orlando, Florida area, please hit us up. Again, it's Set Up Barbecue. I love patient advocacy. I love health and wellness. And like you said, uh, I'm the youngest of three, born and raised in the Bahamas. So I am a natural Bahama mama. Okay. And I wear a lot of hats, but I thank God for allowing me to wear those hats with grace and class and dignity.
Mm, well said. Well said. And I think, particularly as women, we do tend to wear a lot of hats. You really think
Yeah.
about it, like all of that would make a good reel, just all the hats that you wear in
All the
like a
hats
day.
you wear. I agree.
All of the different roles that one woman just
Uh-huh.
has to fill sometimes in a day, let alone a week, right?
I know,
So
yeah.
yes, amazing, amazing. But somehow women get it done.
Exactly.
Women get it done. We handle it. I
We
don't know
just
how,
know how
but
to
we
get
do
it
it.
done under
Yeah.
pressure, under all of the constraints that we have to go through on a daily basis. We know how to reel it on in and get it done.
Somehow it's a
Yeah.
small miracle. I don't
Yeah.
know.
Hmm.
It has to be some God involved. But talk to
Most
us a little bit.
definitely.
Definitely, right?
Yeah.
So, what about this 16, like, okay, that was another one that made me want to stop in the aisle, and you know that when I first like spoke with you, I was like, but I mean, you look younger than me. And when did you have time to be, in acute care nursing for 16 years? I'm trying to still figure out.
Whew. Well,
We're trying to figure it out. There's a secret we
you
have
could
to
blame
get.
the good genes on my mom.
Mm, all right. She pulled the good genes on us, y'all. Okay.
Uh-huh.
She pulled the good genes on us, but I'll get the secret. I'll get the top secret out of Leandria for y'all. Don't worry about it. I'll get it out of her, and I'll share it with you all because y'all know that's what this community is about.
Okay.
Looking great, feeling great.
Yes.
Just over our lifespan.
Yes.
We want to be able to do. We want to be able to look great while we're doing it.
Exactly.
So yes, so
Exactly.
tell us what was your acute care experience like, and how did you then, find, like, come to the realization that you wanted to transition out of that then?
Okay. So I've actually been in the healthcare industry for close to 20 years, to be honest, because I started out as a student nurse care tech whilst I was in nursing school. And so once I graduated nursing school, I became a GN, a graduate nurse. I worked at the bedside for almost, I want to say about roughly 10 years. However, within that 10-year frame, I was within 6 months after being off of orientation as a GN, I was approached by one of my supervisors at the time. And this is so amazing. God is so amazing because he puts people in your pathway that sees potential in you that you haven't even seen in yourself. And so I found it really, eye opening that my supervisor at the time, she's like, you are like really doing an excellent job, even as a GN 6 months out of orientation. You need to start training for charge nurse. So I'm like, what? No, I'm not ready for charge nurse yet. She's like, you're ready to do charge nurse. So I was like, okay, I'm gonna accept that. And so I started training doing charge nurse duties 6 months after being off of orientation. And so I continued on, bedside nursing. Shortly after that, I was approached again, this time by my nurse manager, okay, at the time. And he was like, the hospital is they're looking into implementing this new position. It's called a clinical nurse leader. And he was like, we want you to spearhead this new initiative, this new position. So we're going to pay for you to actually go and get this degree, which is a master's degree. Um, but the only thing that we require from you is, sign a contract to work for at least 2 years with the organization. So I was like, what? Just 2 years? That's all you require from me? Sure. I'm getting an advanced degree for free, and I only have to work 2 years. So I'm like, okay, fine. I wasn't going anywhere anyway, and I know I was going to be there. So so I went and I got my MSN as a clinical nurse leader from University of Central Florida. And then I actually transitioned into assistant nurse manager during that time. I worked that position for about 5 to 6 years. Uh, but I quickly found out that management and leadership was not my cup of tea. Okay. I did not want to put out fires all day long. I didn't want to like micromanage and babysit adults all day. And felt very, I didn't feel good about implementing or enforcing rules and protocols that was uh, created for bedside nurses by executives who has been out of touch from bedside. And that just was not for me. So I'm like, okay, so what else am I going to do from this point? So I thought, I'm going to go back to school and I am going to go for my nurse practitioner. And that's exactly what I did. I went back and I got my postmaster's certificate as a family nurse practitioner.
Congratulations.
Thank you.
Yes, yes. So then after nurse practitioner, then what happened between that and LA
And,
Wellness?
and the new business. Okay. So I worked as a vascular surgical nurse practitioner for 6 years. Okay. I just, I know I wanted more. I know I did not want to work for somebody for the rest of my life. Okay. And so I thought to myself, okay, so what can I do that can definitely, help the community as well as allow me the freedom and the flexibility that I want as an independent provider. And so I relied on the education and the skill set that I gained whilst I was in that vascular surgical role. And that's what led me into doing lymphedema therapy. So I went and I got certified as a certified lymphedema therapist. And this was still all going on whilst I was full time. So building my business was still, the foundation of it was done whilst I was still working full time. And so, yeah, that's how I kind of got into doing lymphatics. And then I started liking um, taking care of people, surgical patients,
Mhm.
and I like aesthetics. And so I added on the non invasive body contouring modalities to my business as well.
Wonderful, wonderful. It's
Yes,
a it's a unique skill to be able to look at the market and see what is available, what's
exactly.
not available, and then
Right.
kind of fill in the need where it
Yes.
is. So
And it is definitely a
it's
need, especially with lymphedema patients, because I can tell you there is maybe a handful of traveled um, CLTs that actually go out to the client's homes. You barely see that anywhere.
true.
And especially for me as a nurse practitioner, I'm considered a provider, which is even more of a unique skill set
Mhm.
for me. Because you're not gonna see any providers going out to clients' homes to do lymphedema therapy, honey.
I would say it's rare.
It is very
I would
rare.
say I would say it's rare. I would. I agree with
Mhm.
you on that for sure. All right, so this is quite a progression, such an interesting progression from where you started as a student nurse now to nurse practitioner to certified lymphedema therapist to entrepreneur.
Yeah,
Wow, what a journey, and it's still continuing.
yeah.
So, what are the diagnoses that you primarily see now? I know you kind of still you started off with the vascular when you were still with the surgeon, but
Hmm.
what do you see a lot of out in the field?
In the field, well, most of my clientele are patients who have lymphedema, patients who had surgery, plastic and cosmetic surgery, and those who are looking to enhance their natural beauty through, non-invasive, non-surgical modalities, which is through body contouring. I still do telemedicine, which is one of the service lines that I added to my business. So I do telemedicine, and I have the capability of, you know, evaluation and management of other chronic diseases such as high blood pressure, diabetes, uh, chronic, uh, you know, a lot of the other like chronic diseases I am able to evaluate and manage through telemedicine.
Mm, that gives you a very wide range and lots of options.
Yeah.
So, yes, can you give us some examples of like your non-invasive procedures for body contouring, just in
Okay.
case the people would like to get an idea of what that actually entails?
So with body contouring, you're gonna have services such as cavitation, radio frequency, laser lipo, wood therapy, ultrasound therapy are all different types of non-invasive modalities that you can use to help shape and mold the body. Cellulite therapy, infrared light therapy, and the list kind of goes on and on. But those are the most requested procedures that I do in my business.
Okay. Again, lots of options. I think that's excellent. And you're able to provide that in home or at an Airbnb or in a
Yes,
hotel. It just
yes,
really gives so much options.
it is.
Okay. So then talk to us a little bit about what's the role that the lymphatic system, which if anybody follows this page, particularly on Facebook, like I said, is different content on the different outlets. So we talk
Right.
about lymphedema a lot on the Facebook
Uh-huh.
page, right? So if anybody is not familiar with what is the lymphatic system anyway, you can give them an idea of what that is. And then
Okay.
Tell them what that has to do with post-op care.
Okay. So, first of all, with the lymphatic system, I think is so underrated and it doesn't get the recognition that all the other systems of the body does. But it plays a very vital role in our body's health. It gets rid of toxins. It helps with fluid balance and shifts. It helps with our immunity. We have almost 600 to 700 lymph nodes throughout our bodies. Um, the major lymph node beds are in the neck or the supraclavicular area, the axillary armpits area. You have the deeper lymph nodes in the abdomen, and then in the inguinal areas are where the major lymph nodes are located. Now, when it comes in terms of postoperative care, as a post-op provider, you need to know the channels of the lymphatic system and how it correlates to the surgical procedure that the patient has or the client had. Um, the most important thing is you need to understand where to move that fluid out of the congested area of where they had that surgical procedure into a non-congested area. And I always stress when you're looking for a post-op provider, make sure this is somebody who is trained, that has an MLD, water trained MLD or a CLT to provide you with post lymphatic massages or post lymphatic drainage. Now, a lot of times there is a a back and forth with the names. Some say drainage, some say massages, some say it's just a whole host of things. Okay. But I know it as manual lymphatic drainage. Okay. It's not really a massage, but it's a drainage. um what else can I tell you about that? So with doing MLD in a post-operative patient is completely different than in somebody who has not undergone surgery. Uh, Again, you have to know the lymphatic system, the intricacies, the channels, and where to move that fluid in order to reduce that excess fluid that has probably been, not probably, but is accumulated after surgery. Some procedures are that some procedures produce more fluid than others, like a tummy tuck and liposuction will definitely produce a lot more fluid buildup after the surgery. Because if you think about it, with a tummy tuck, you are losing a lot of tissue, excess tissue. With liposuction, they're using actual cannulas that suck out all of that adipose tissue and fat and stuff like that, and it's creating a tract. In that tract, you have serous fluid that builds up, and that's where all that excess fluid comes in. Not to mention you're given medication in surgery, you're given fluids in surgery, so all that is congesting the body and the system afterwards. And so the major role of the lymphatic system is to process a lot of that excess fluid and get rid of it get rid of it through urination, pretty much.
Yes, you answered one of the most common questions. One of the most common questions is, well, then how does the fluid come out? Because they ask when they hear drainage. So let's go back to that terminology. You have drainage or massage. Now,
Hmm.
basically, people that I think that when they train us, they tell us like, don't let anybody call this a massage. Don't let me hear you calling this a massage.
Uh-huh.
So you come back with that from the training, and that's ingrained in you. And now you don't want to let anybody else really call it a massage in your hearing either.
Right.
So you're like, no, this is a drainage. But when you say
Uh-huh.
drainage now, people are like, is there a needle involved? You're like,
Yeah,
wait a
no.
minute. That's why the term non-invasive is also very good to put in there in our
Uh-huh.
explanation to potential patients and clients as well, so that they can understand that no, I'm not coming at you with a needle. Just
Right.
a series of very gentle strokes,
Uh-huh.
specific order, and they're meant to just affect the lymphatic system. So I
Right.
would say too, you kind of hit on another thing, which is that you do have persons that have not undergone training, and I suppose there will always be that in every field that
Mm-hmm.
are, but I always say I put it back on the public to do their due
I
diligence
agree.
and know
Yeah.
who is giving them treatment and if that
Yes.
person is actually qualified in order to be doing so.
Right.
And
And I totally agree.
because that can happen, and then you always know when you ask them, it was, if they say it was painful or anything like that, it's not a deep pressure.
Right.
So it's not meant to be painful, the whole process.
Exactly.
But
Exactly. I'm
they
glad you
ask,
kind of segue into that because I know that was a question coming up anyway. So seeing that we're already there.
go right
Yeah.
ahead, go right ahead.
Let me tell you, when you're looking for a post-op
Mm-hmm,
provider, here's some things you want to look for, okay? You want
mm-hmm.
to make
Give
sure
it
that
to
that person is a licensed medical professional. All right. You want someone who is trained adequately in MLD and as a or has a certification as an MLD or a CLT. You want to stay away from, and I might get some dislikes for this, but you want to stay away from people who has had, them weekend trainings, that because there's so many people that's popping up that want to train other people, but when you look at their curriculum, when you look at what they're teaching these people is not so good.
them.
And I've heard a lot of stories of people who have gone to these such trainings and still trying to figure out, you know, what they spend their money on because they
Wow.
didn't get the so-called post-op training or body contouring training that they was looking for. So I would say do your due diligence, search for a training program that is going to give you the scientific background, that is going to give you the evidence base on the reason why you're doing certain procedures. Find someone who is going to answer your questions and also be able to explain the rationale behind their answer. You want to find someone who can do a full assessment, who can build a protocol based on the way that your body is presenting. You want to find someone that is experienced, obviously, with taking care of surgical patients. And you also want to find someone who can identify if there's a complication and what to do in that circumstance or who to refer you to in order to get that situation taken care of.
Mm, yes.
Um, one more thing, everybody, you can't work with everybody. So find someone who you could kind of gel with and your
Mm-hmm.
personality kind of aligns, because it's going to be a journey after surgery, and you want to be in an environment where you can talk and relate and be in a soothing type of environment, and not stuck with somebody because you didn't ready pay your deposit and you didn't already paid your money down, and now you have to get these services with this person. So I would say do a consultation before, do it, whether it's a phone call or whether it's a virtual consultation or even in person, just so you can see, the type of person this is that you're going to literally put your life in their hands.
Mm.
And yeah,
Wow. Wow.
it's a lot.
All
It is
excellent
a
points.
lot for a
All
post-op provider. I
So,
look, any Joe
yes.
Blow cannot be a post-op provider. Okay, I'm sorry.
Well, you said it.
I
You
know
said
I
it,
probably
Marie.
gonna
You
get a
said
look.
it.
I'm gonna
You said
get
it,
some
Andrea.
dings for
You
that,
said
but
it.
it had to be said.
You said it. Okay. All right. So we would like to invite the viewing audience at this time. If you have any questions for Leandrea Long, for Mrs. Long, please do go ahead and pop them into the comment section at this time. So we'll give you the opportunity to do that. And let's see. Uh, Special announcements coming up. Let's see, what do we have coming up on our calendar? So, as you all know, we are bringing the show to you, the live stream. I want you to just go ahead and make sure that you like, follow, and subscribe to all of our social outlets or your favorites. Like I said, you may have a particular type of content or information that you're looking for, or you may just have your preference for platform where you like to hang out. We are live streaming now to LinkedIn, YouTube, Facebook, and Instagram. So if you want to catch our live streams, which are going to be when we find special guests, our guest experts, such as our special guest this evening, you're going to be seeing those streams. So you'll need to be following our social outlets so that you know when the stream is coming up so you don't miss it. Okay. As always, we do invite you to share our content so that more persons that need this information can actually get it. We want to be able to help and reach more women, and we can only do that with your help. Okay, so we need you to help us get the word out. All right. So we do have, of course, some things coming up. I know that I have a podcast that I'm going to be a guest on, and that will be next month. So I'll definitely share that with you all once it is published. There's lots and lots that's going to be coming up. It's going to be, of course, exciting. I have a lot coming down the pipeline. So please do stay tuned, stick with me, stay in the community, and you'll be first to know everything as the information is going to be released. All right, thus far, I don't see questions in the comments. So Leandria, could you please tell everybody where they can find you online so that if they want to give you a follow and keep up with what you're doing, you're our like homegrown, you're our home girl from our hometown, just across the waters there in Florida. And, of course, we want to be able to support you. So where can they find you online?
So I have a website. It is leandrealong.com. I am also on just about all of the social media platforms except for Twitter. I still cannot figure out how to work Twitter, but anyway, um, I am on Facebook and IG as well as LinkedIn. Um, the personal page is my name, Leandra Long. The business page is LA Wellness Center. And I think that's about all as far as the
Awesome.
social media. And yeah, of course,
Awesome.
my website.
And give us the website again.
It's www.leandrealong.com.
Wonderful, wonderful. Well, we certainly thank you. We cannot thank you enough for coming and sharing with us this evening. We appreciate you so much for taking this 44 minutes away from your family, away from your life to come
It's
and
all
share
good.
with us this evening. Like, we appreciate you like 100,000%.
I appreciate it too. I want to thank you for
Oh,
having me on as a guest and allowing me to tell a little bit about my story, and bring in awareness to this industry.
most definitely. Oh, I do think we do have a question coming in at the clutch here. So let's see. Our viewer asks, what three major procedures would a lymphedema therapist have on their resume? So do you mean what three procedures would we treat, or like what types of treatment do we give?
Right.
Just clarify that for us, and I will have our special guest, our guest expert, answer. So if you just clarify that for us, we're just going to wait for your response to come through, and then we'll go ahead and get that question answered. And if there are any other questions, now is the time to pop them in before I before we say goodbye to our guests for this evening?
It's all good. I have some time.
Okay, so basically treatment.
So, as a certified lymphedema therapist,
What is it?
so
What is the type of treatments?
the major treatments is for patients that have lymphedema. So that's anybody who is a cancer survivor who has had lymph nodes removed, who's had chemotherapy, radiation, and has had, damage to the lymphatic system, which causes that excess fluid to build up in that particular limb. So as a CLT, we are trained on providing manual lymphatic drainage, providing multi-layer compression, being able to assess the skin and nails adequately, give advice on types of exercises that will help with lymph flow, and also be able to measure the clients in order to get custom garments or even off the shelf garments to help with controlling that swelling. Hopefully that answers your question.
Yes. We barely touch compression tonight.
I know that's a whole other kit and caboodle, okay?
That's
That's
a
a whole other
whole
life.
that's a whole other thing.
I
It's
don't know,
so
maybe
important.
in like as it relates to post-op, I don't know, maybe if that's where their question was kind of going to. But with
Mm-hmm.
ML, with being a CLT, in relations to post-op, again, like I said earlier, being a CLT, we learn, the lymphatic system, we learn the channels, we learn where the major lymph node beds are. And so we as CLTs, depending on what type of procedure the patient had, so say a tummy tuck or liposuction, or if they even had a BBL, breast aug, we know where to move that fluid out of the congested area where they had that surgery, and move it into an area of non-congestion, and that way the body can process it and you urinate it out.
Mm-hmm. Very, very comprehensive answer. And I do believe that
I hope
our
that
viewer,
answered that
I
question.
believe that satisfied the viewer's question. All right. So there are no further questions at this time. I will just thank my guest once again, our special guest expert, for coming and sharing with us this evening. I am so glad to have met you. The internet is a wonderful place. And I
It is.
don't know how we would have
It
met
is.
otherwise. So that
Right.
was amazing. We just kind of ran into each other in the internet streets. And
Right.
that
I
was
want to
amazing
also
and
add one more
wonderful.
thing before we go.
Please
So,
go
for
ahead.
anybody who is planning on having surgery, a key factor is what supplies you're going to need after surgery. So, I have created a comprehensive supply list for you. It's a free download. It's in the link in my bio on all of my platforms. So you can download that for free. I took the time that you had to go searching for stuff. I'm going to help you save some money so you don't spend money on things that you are not going to need after surgery. The supply list is all there for you. So you can download that for free from my social media pages.
All right. So click the link in the bio. Get that free
Yes.
download. You can't beat a free download. Okay.
Yes.
So let's do that. And don't forget that you can share it with others too. So if it's not information that you need yourself,
Yeah.
2 to 1, you know somebody that does need it. Okay. So
Exactly.
always be that person that shares the wealth of information. All right, so we have some thank yous here, just thanking our guest extra for the evening. Thanks to all of our viewing audience for coming and for spending this time with us this evening. We appreciate your presence more than you know. All right, so we do hope that we see you back somehow in
Oh
some way
yeah.
on our
We
lives.
definitely need to do this again, Dr. Felicia.
Yes, yes, and you may not know, but I'm full of ideas. So I'm gonna have some other things that other ways that we can work together too. So
Okay.
there's so much that the internet has just opened up the world to. It's
Exactly. And
opened up the
there is
world to
power
us.
in
So
collaboration. That's for sure.
yes, I love a good collab. All
Yes.
right. So
All
thanks
right.
again for coming. And as to our viewers and our viewing audience on all of our platforms, this is Dr. Felicia signing off, making the world healthier, one woman at a time.
Thank you.
Bye.
Bye.